Monday, June 15th, reported 30 new COVID-19 cases, bringing the tally of confirmed cases to 612 since mid-March, when the country registered her first case. Diana Iriza reports from Kigali, Rwanda.
Rwanda reported new cases on June 16th, bringing the total confirmed cases to 612 and the active cases to 172. According to the Ministry of Health, new cases are Rusizi and Rusumo clusters, as well as repatriated Rwandans. So far, 338 patients have recovered from the pandemic, including 6 who recovered on Monday. The last 3 days have been the highest ever, with Saturday recording 31 cases, Sunday leading with 41 new cases, and on Monday 30 cases. The Ministry of Health indicates that it is mostly because they increased general testing in the most affected areas, Rusizi notably. We spoke to a few local residents to hear their thoughts on the new coronavirus wave in Rwanda and how going back to a lockdown would affect the country.
We came up from a big problem. People were not having food to eat. That's why the government came up with the issue of easing the lockdown. But we realized that the lockdown still, the easing the lockdown, the disease is not going down as we expected that maybe. And we realized that we are shooting up in the numbers of cases. So in my suggestion, I think the better solution that the government might come with is that maybe we start mass testing of testing everyone as it was done in other countries. We saw take an instance like South Korea. South Korea, they were not in lockdown, but what the government did was to ensure that each and everyone was tested.
I don't wish to go back to the lockdown because our businesses are running smoothly, like transportation is also good. Yeah, but if cases, if cases, keep rising, I think the government will take such measures to control and prevent the citizens from, falling victims of coronavirus. Yeah, but I don't wish and I don't think the lockdown is necessary.
Of course, they are going to be affected economically because businessmen who give tax are not going to get money because they are not working. And even other people who are working are not going to get salary because they are not working because we are in lockdown. So I think we can take measures, those measures that we've been taking, and we keep maintaining them instead of going back to lockdown. That's my suggestion.
According to the Rwanda Biomedical Center, Rwanda is currently carrying out an assessment that will establish whether the resumption of the interprovincial movements and passenger taxi motor services have had an impact on the prevalence of COVID-19 in the country.
This is a particular group that is highly mobile and transport a lot of people in a very short timelines. That's why the risks have been assessed at different times. As Rwanda Biomedical Center and Ministry of Health, we've been conducting different surveys, both to the potential clients of the motorcycles and drivers themselves. As we speak, we've been testing a number of them randomly to see if there are no virus moving or circulating in those groups.
Let's get to the world of